So I'm sitting with Dr. Angie Lang. Lovely to spend some time with you, Angie. And you're back in Australia, I understand, from a recent trip to Saudi. Is that right?
Yes, that's right. Glad to be home.
That's good. So, Angie, tell me a little bit about your role in Australia in dentistry.
So I've been practicing dentistry for over 20 years. I was very fortunate when I graduated with a fantastic boss who gave me a lot of confidence and skill to learn quickly, as a new graduate, and to give me the ability to kind of branch out into my own after just 18 months after graduating. And I set up my own dental practice, great practice in Cronulla called Love Your Smile. My mum was my practice manager, and we set up a wonderful local business where patients were like family. And honestly, it was I don't think I would be where I am today without the ability to kind of have the insights I did, because the patients really kind of let me in a sense. In Cronulla, I stayed there for 15 years. After that, I went to a practice in Paddington, just around COVID time. Probably stayed there longer than I thought, because it's a great practice. But yeah, COVID just kind of changed everything for everybody, really. But it also gave us an opportunity to kind of reshape what we've been doing as far as innovation, something that I've been working on since 2007, which is where we are today with SmileSip.
And I really want to talk to you a little bit about that in a little while, but I'd like to ask you another question. I understand you play quite a role in dentistry in Australia, sitting on boards and other things.
So going back to my first boss, he inspired me to study law. And also he was the president of the Dental Council, and so I kind of saw what was involved there with the regulatory aspects and governance aspects in dentistry. So in 2011, I was nominated to the Dental Tribunal, and that is something that I still do today. And so I've also been involved with the Impaired Registrants Panel, so overseeing hearings under the Health Practitioner Councils Association. So aside from clinical dentistry and having studied health law, I've also been lucky enough to have involvement in the profession from that aspect. But yeah, going into research side of things was something that I did on my own. It was kind of like my hobby, I guess.
Yes, because I know that many years ago you started to tinker around and innovate, looking for new products in this area. And you mentioned Love Your Smile.
Yes.
And I think that sort of stuck with you for all these years. And how does that tie into the story of how we've got to today?
Yeah. Well, Love Your Smile is something very kind of personal for me, I guess, because when I opened my dental practice in 2005, everyone was terrified of dentists, it seemed. And I wanted to be able to change the way that people approach dentistry. I wanted to take away the anxiety and make it something that was approachable. So I had my nurses and practice manager all wearing pink. The walls were pink, the door was pink. Everyone knew us as the pink dentist. But it was kind of almost a bit of a cultural thing within the practice that we just wanted to make patients love their smile. So and because it was a different approach, and as I said, people let us in, and we were able to take patients along that whole journey. But that's where it kind of inspired me to kind of look beyond what I was doing in the dental chair, because identifying that so many problems that people were experiencing on a day-to-day basis, they were completely preventable, but there wasn't anything new that I could offer them to say, okay, let's try this to kind of change the course of their oral health issues. And that's where I started doing my own research.
And that's where you decided that there was an opportunity for a whole new category in dentistry.
Yeah.
And I understand that's in the drinks category.
Yeah, absolutely. So, there's a few patients that kind of come to mind and I really inspired this. And Yeah, some of them, like, they were actually trying to do what they thought was the right thing for them as far as their oral health is concerned. They were eating well, they were exercising as well, like, really healthy people. But I take photos of people's teeth every 6 months, and there's a pattern of wear and damage that you see when people are consuming acidic drinks. So it wasn't just about the sugars, it's about the acids as well. So when I would counsel my patient and say, if we're going to prevent this from happening again, you've got to stay away from sugary and acidic food and drink. And when they say to me, well, what can I drink? And I literally couldn't offer them anything else other than water or unsweetened tea that wouldn't cause that damage.
Because pH neutral, of course, is the critical position you need a drink to be, so that it doesn't damage your teeth in any way.
Yeah, absolutely. In fact, there's a critical number there when it comes to will a drink do damage to your teeth? Yeah. And that is 6.3. Right. So if anything is below a pH of 6.3, meaning more acidic, that means that the dentine will dissolve. But if anything is 5.7, the enamel's dissolving as well. So once that tooth structure's gone, you don't get it back. So what I sought to do was to be able to create something, or at least first find out if there was something else available. That was kind of the first piece of the puzzle, because I thought, this can't be right. It can't just be water and tea. So that's what started off my journey, trying to find a solution for that problem.
Oh, well, and that evolved into what now today is this world first drink that you've created, and now I understand is available widely across Australia from March this year.
Yes.
SmileSip.
Yes.
So tell me a little bit about SmileSip. It's oral health on the go, I understand.
Yeah, absolutely. So we've solved the problem of providing a drink that people could consume that would not cause decay and erosion, just by virtue of being sugar-free and pH neutral. But what we've done is also formulated it in a way that they're getting more than just something that won't cause damage. We're giving them something that will actually give them a benefit they can feel straight away. And those benefits range from dry mouth relief, which is just so soothing. That benefits people of all ages, especially aged care patients, especially people who are athletes, people who are talking a lot, like me right now. When you're traveling, the dry mouth relief is something that's just got to be felt to be believed. It's quite unique. It gives you an instant clean mouth feel. So you can consume it and all of a sudden your teeth feel smoother. You can actually feel the mouth is clean and fresh, but it's without that harsh mintiness. It's a very subtle feeling, but it's very pleasant, clean feeling. It prevents stains on the teeth. And that's done because it changes the surface tension on your tooth surface so the stains don't stick. It prevents dental decay by virtue of the amount of xylitol that we've included, which is backed by science. We've guided our quantities, based on what science says is going to have benefit. But aside from the prevention of dental decay, the xylitol also helps to neutralize acids, not only in the mouth, but you can feel it in the gut as well. So it's quite a funny thing when you, for instance, you could eat onion, you could eat garlic, could have a nice Indian curry meal, and you can feel that maybe mouth isn't as fresh, and you can feel in your gut, and this relieves it straight away. So it's quite unique in that way. Also helps to soothe the mouth. So if people have irritable gums, it's just a nice instant soothing feeling.
And that comes from ingredients that have proven scientific backing.
Yes.
Can you explain that for us?
So I was initially in search of sugar-free, pH neutral, but then I thought it was actually quite interesting how I came across this. But I discovered a mix of ingredients that not only backed by science, but helped to change the way that bacteria sticks to teeth and how bacteria metabolizes, traditionally sugars in the mouth. And we found a way to also make the ingredients stay in the mouth for longer, so they're actually having that benefit long after you've actually drunk SmileSip. So with those ingredients, we created a proprietary blend of some prebiotics and then some botanicals and minerals that we kind of create the...
So this effect of staying in the mouth, so this is where you can prevent stains on teeth, but also it leaves a longer term active positive action in the mouth.
Yeah. So because these ingredients are they're staying in the mouth longer, this is kind of activated by the viscosity of the liquid. So when you drink SmileSip, you'll actually feel a little bit of it. People describe it as being velvety compared to your normal water. It's not as kind of liquidy and runny as normal water, but it's a very pleasant feeling. Now, when you're drinking this velvety liquid, it's actually getting in around all of the surfaces of the teeth, and it's keeping the beneficial ingredients in place.
So very important for people with braces or people with aligners, let's say. Is that the thinking? Because I do know that there's quite a deal of staining that does come sometimes from aligners, and also obviously coffee drinkers understand, and wine drinkers know that stain.
Yeah. So also people with dentures, people with a whole variety of dental appliances and prosthetics in the mouth. So it is not only kind of something that you can feel and you get that instant benefit, but you have a prolonged benefit as well.
So SmileSip, so I guess you sip it. Is that the concept?
Yeah. Well, sip it, drink it, enjoy it however you consume your beverages. But it's very easy to enjoy this oral health on the go concepts. Like we take a sachet, it just comes in a powder, and you put it in your water. Can be tap water, can be bottled water, can be room temperature, can be cold. And
so in your tap water, you get the added benefit, of course, if you're in the fluoridated area of getting fluoride. Look, this has been really interesting. I understand you've done some work with Dental Health Australia in the development of this.
Yes. So Dental Health Australia has been around for a long time, and as a very prestigious board of academics and people that are kind of mainstays of the dental industry, and to have been recognised as having a beneficial impact for dental health in Australia. We're very fortunate to have this alignment with Dental Health Australia.
That's great. Look, thanks, Angie. That's been really interesting chatting to you. Good luck with this. So it's available through Woolworths and online, I understand?
Yes. So very excited for this Woolworths participation and recognition that it is innovation in your oral care aisle, but it's a drink.
It's a drink. And who should be seeking it out?
Yeah, look, if you've got teeth, if you are consuming a drink that would otherwise contain sugar or acid, this is going to be better for you every time. So children, we do have a children's variety, which is available online, and 5 flavors as well online. And look, I would be recommending people of all ages, if you are looking after somebody, if you're a parent, put it in your kids' drink. They love it. Lots of flavors to choose from as well. If you are, if you've got you're caring for somebody who may need assistance with their oral health, this is so beneficial for them. My patients that have experienced this, it has been a game changer, especially from the dry mouth relief perspective, especially because they don't have to spit anything out, which can be messy. It can be it's not the ideal situation when having to care for somebody and using traditional oral care methods. This is a nice alternative.
I know it's very difficult for people caring for the aged and even carers in aged care facilities. And we saw, obviously, with the Royal Commission into Aged Care, just the impact of poor dental hygiene on morbidity amongst the aged. So I'm imagining that this audience would be well wise to consider adding it to anybody that's in that sort of circumstance to their drinking water.
You know, I, as a dentist, my recommendation in that situation would be, quite often in aged care homes, they're having their tea with, a couple of spoons of sugar, or they're having a lemonade in the morning with their morning tea. These are opportunities to substitute one of those drinks that's actually causing damage and give them something that's not only they're going to enjoy, that's going to help their oral health, but it's also going to help with their dry mouth they may be suffering from the multitude of other systemic complications they might have, or systemic conditions rather.
I know I've heard you speak before on the subject of the mouth being the gateway to your overall systemic health, and you've just mentioned that. But there is significant evidence that a lot of the conditions that we're all trying to avoid have originated in the mouth.
Yeah, absolutely. It's really interesting that, look, I think the mouth is going to get more recognition for its impact on systemic health. For the last kind of 10 years, gut health has been focused on quite heavily, but anyone that has oral disease cannot have a healthy gut, because that is bacteria that is, of course, you're swallowing it, you can be aspirating and it's going into lungs as well. There are so many distant areas that oral bacteria is going to reach. When people have gingivitis, that's bleeding gums. Exactly. And bleeding gums can occur in the majority of the population. If you see blood when you're brushing your teeth or when you spit out, that's gingivitis.
And that's not normal. If your skin was bleeding when you touched it, it wouldn't be normal. And it's not normal in the mouth. Yeah.
So we need to normalize good oral hygiene to prevent, the idea that bleeding gums are normal. But the research has shown that the bacteria from the mouth, when it is exposed to the blood in the mouth, will travel, as I said, to distant areas, and it tends to get blocked up in this tiny little capillaries where there's been inflammation. So sometimes, before someone has, for instance, heart surgery or knee surgery, number one thing the surgeon says is go get your teeth checked first, because knee replacements fail because of oral bacteria causing infection at a knee. People die because of clots, where Porphyromonas gingivalis, bacteria only found in the mouth, is found in the small arteries and small capillaries in the heart as well as in the brain.
Yeah, look, I think we're coming to learn a lot about the importance of oral health and oral hygiene. Congratulations on developing something that gives us an opportunity to approach this in a different way, other than not suggesting, I'm sure you're not suggesting that we don't brush teeth and don't use mouthwashes and so on, but this is a very convenient on-the-go method of bringing a whole new idea to your oral health routine.
I think you're absolutely right that this is a way to access oral health on the go. You still must brush morning and night. You still must visit the dentist for your general checkup, make sure everything's in good check. Have a good diet, all of those things. When it comes to mouthwash, I would caution people on mouthwash. You're not supposed to use it for more than 7 days. It says it on the bottle. It can have other issues if not supervised by, if a dentist hasn't recommended it. I wouldn't necessarily go down that path with a mouthwash. But, SmileSip is a way to complement your oral care routine.
Well, let's hope your Australian innovation goes worldwide. And thank you very much. I've been chatting with Dr. Angie Lang, and this has been most interesting. Thank you.
Thank you so much. Sure.